Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life in Balance. And today we're going to talk about, it's really an exciting idea and concept, but it flies in the face of what modern oncology does. And that is generally trying to find the most toxic thing we can find without killing the actual patient. And so chemotherapy, radiation, posted a video a couple weeks back based on, it was a review looking at a lot of the recent cancer drugs in the past decade or so. And unfortunately, most of these drugs actually didn't extend survival. They were very expensive. And it really was saying that we're just missing the boat by having such a heavy focus on finding the next greatest shiny new drug, when there are tools that we know of that can be just as powerful or can be used along with chemotherapy or radiation for better outcomes with less toxicity. That certainly would make a lot of sense, and especially if they're inexpensive or actually like no additional cost. And that has to do with calorie restriction or fasting can be a very powerful tool for cancer treatment. And we've seen this before. This isn't a big surprise. This shouldn't come as a shocker. We know that when you hear that, sugar feeds a tumor, that's not that big of a surprise. And fasting has some pretty powerful benefits if done properly on immune function. And so this particular study was not on cancer outcomes, but certainly on everything surrounding that. And it was a small study, it was on 101 patients, and they did what they called a fasting mimicking diet. And it was basically a low carb, so 5 days of low carb. So the first day was low carb, low protein, plant-based. First day was 600 calories, the next 4 days were 300 calories. So really pretty low, but it's 5 days. And then they took up to, they take 3 or 4 weeks off. So basically 1 week out of the month, you'd be doing this, 4 weeks, 3 or 4 weeks off, and finishing up to, in the study, up to 8 cycles. 92% compliance. So most of the people in this study did a really good job of sticking with what they were supposed to do. And so what did they find? First of all, fasting can be associated with weight loss, which is not always a bad thing, but we don't want to lose muscle mass. And they found that in the refeeding period, that in between, that people regained the weight that they lost. But interestingly, they saw fasting blood sugar went down by 19%, fasting insulin by 50%. And insulin is a pro-cancerous, it's a proliferative hormone, so it's a pro-cancer hormone. So dropping that by 50% is a pretty powerful effect. And insulin growth factor 1, which is another compound that's associated with cancer growth, dropped by 30%. These are some pretty big changes. Other immune markers, both systemic and at the tumor level, improved. So while this wasn't a end cancer study, so we're looking at our outcomes, and I certainly talk about using surrogate end markers, which is what they did in here. But this is a different story because this makes sense. There were no side effects. There were no cost was not an issue. On the flip side, nobody has any money to be made off of this. And the authors talked about creating a metabolic shock to the body. And what happens is our body does really well putting it to the test and shocking it, whether it's through cold, whether it's through calorie, there's oxygen tension, so hyperbaric, so our body, but cancer cells do not do well with that. They don't adapt. And so we're forcing our bodies, the normal cells, to adapt where the cancer cells can't. Really interesting look, and unfortunately this is not a direction that mainstream oncology generally takes, but it's a potentially powerful tool at managing and improving cancer outcomes. So, as always, I will post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.